Thank you very, very much. So we come to this, our last Q&A session of the day. If you're table 6, 7, 8, 10 or 11, we're especially keen to hear from you, but our panel are at your disposal. We might do the same again if there are a lot of questions. We might take one or two and then we'll direct them to the panel. But who would like to start us off with a question for our panels? I think that is table 11.
Thank you, and thank you to the panel for your time. We agreed around the table that really, based on what we've heard in this assembly and the last, that there really is a fundamental change that needs to come around legislation, that what we're doing isn't working and hasn't worked, and really the core of our legislation probably needs to change. We need a more linked up approach and joined up thinking. So we just wanted to ask the panel, if you could change one fundamental thing, what might it be?
Okay, one fundamental thing. It's hard, Jennifer, when it's so multi-layered and so complex, but what do you think could be a game changer?
Oh God, it's hard to pick one thing, but the first thing that comes off the top of my head, and myself and Amy were just talking about it here, is housing policy. That how we build social housing and affordable housing, how we, it's all bunged in together, so we create then environments that are, open to drug markets and drugs economies, that it needs to be more integrated, and there needs to be wraparound supports for people who are placed in social housing. We were just kind of talking about cuckooing is a new phenomenon the last few years, where vulnerable people are housed and people move in and take over their property and deal and use from that property as well. So there needs to be changes in housing policy, how it's allocated, how people are supported, and then if something like cuckooing happens, that the tenant doesn't have to make a formal complaint to the guards, that the guards and the local authority have powers to remove people from the home, people who are vulnerable.
And for you, Amy?
Yeah, I think for me it's looking earlier. So actually, how do we tackle some of the underlying issues of poverty and inequality? How do we support young people from an early age? How do we improve our education system and their experience of the education system, so that there is other options for them? Because at the moment, their options are to move into the drugs trade are often their best options. So it's looking actually at services earlier and investing in youth services and in childcare and all of those pieces.
Is actually, John Paul, tackling or trying to mitigate, you can't avoid them all, but those adverse childhood experiences we're talking about, or do you think there's something else?
Again, it'd be difficult in terms of that. I think early intervention and clear pathways into recovery has to take place. I think it's extremely difficult at times in terms of accessing recovery, and I think there's just fundamental blocks that can easily be put away, discarded really.
And Philip, is it legislation or is it services? Well, it's probably all of those things. What do you think?
Well, I think it's both. But for me, I'd say a very effective approach would be if we could support every child in the state from 0 to 10 years of age in their education and target. Now it doesn't have to be every child. If you resourced services to look at every child, and if we just take areas of disadvantage, for example, as Niamh Hourigan said, in understanding limit, there is advantaged people and the disadvantaged of the disadvantaged. So already you can see that every child wouldn't need the supports and services. But for those who do, they should be supported from the cradle to they're about 10 years of age. And then you can identify the family support needs of the parents and the other siblings in the home. Do you know what I mean? So by getting in early and having a focused support for every child in the state as a right, let's say, and then for those who don't need it, they don't get it. But for those who do, then there's a wraparound service there. But services need to be obliged to respond to. Yeah. I heard somebody saying earlier there was kind of a silo when it comes to services, like wanting to take on more work or whatever. But they should be obliged to go in there and do their little piece. So if you're a social worker, you do the social worker piece. If you're a family support worker, if you're a teacher, you do your piece. It's not about it's about bringing coordinated wraparound service for the child.
Okay, thank you very, very much for that. I have two questions, one at 6 and one at table, actually lots. So I'll take 6 and 9 and then I'll take the next two after that. So table 6 and table 9.
Thank you very much to the speakers. Really appreciate your input. Our question is really for Philip, and it's around tackling the multi-million euro industry that's funded by the recreational users. And you already mentioned about a national campaign of awareness might be helpful, but we're just wondering if there's any other suggestions you might have to tackle that piece. Thank you.
That's great. And before Philip answers, I'll take the question from table 9 as well. And please do feel free to both individual or general questions, but table 9.
Yeah, thanks very much to the panellists again. The question here was just obviously the profound story of the 6-year-old kind of saying, "Oh, I'd like to be like that drug dealer." What do you think is needed in the community to kind of breach or break the cycle of entry into drug use at young ages? And do you think there's anything specific that might help stop the entry of like young individuals into the kind of cycle of drugs?
Okay, so that first question, Philip, for you on that relationship between recreational drug use on one hand feeding into that much, much bigger global multi-billion-dollar industry that is.
Well, I think people who use drugs recreationally think it's a passive pastime. They don't think that it's harming anyone, but yet it always harms somebody. You know, there's no way, as we showed, with just €10 a week, and as I said, you won't get a kick in a rush in the drug trade for €10. You get nothing. But at €10 a week, if you multiply that out by 600,000 people who are now, and Senior Gardaí have told me that that's a very, very conservative figure. So we don't know. People are not honest about what they do, but we do know that it's causing huge problems, you know. And as I mentioned before, young Anthony Campbell, he died tragically. So what we need to do is to get an information campaign out that will inform people of the damage that they're doing to society. They either ignore or they're unaware of the damage that they're doing. And so they need to be educated. If I ask people, you know, what are you doing that for? Where's your money going? It's only tenner. I'm not doing anyone any harm. I'm only doing it to myself. But they're not. You see how it progresses through. They get in trouble themselves and then their parents. And you see primarily here mothers start to try to cope on their own. And then when all is said and done, the mothers are left with the guilt. And then they're going to counselling for their guilt and how can I, what did I do wrong? Oh, look, my other children are all right. And so they do huge damage, you know, but it's not something that they know. Now, say for Blanchardstown did develop a campaign called Think Before You Buy. And it's about kind of kickstarting, it's trying to kickstart a conversation around those harms so that people actually know what they're doing. They don't realise it. So that needs to be, in my view, that needs to be.
And what do you do, Amy, then that's age appropriate for a 6-year-old who has aspirations to be like the guy in the corner?
I think it's going back to the bigger picture of why that is an appealing, why that is something that is appealing to them, and that's looking at, well, what are the other options that they're seeing? And, you know, we were speaking about the lack of role models, particularly the lack of male role models a lot of the time in communities like ours, and having other options for young people. And that does look a lot like investing in education and in support services. There's a lot of supports that have been increased over the last few years for early years and 0 to 6. We've put a lot of emphasis on that as a country, and then youth services start at 10, but that's 6 to 10-year-old space. There's no additional supports outside of school for that. There's no statutory services there, and that's a space where actually a lot of young people start to fall through the cracks, and problems start to arise. And there's scattered services, but there isn't any unified approach to that.
I know, because at our first session, Philip McMahon spoke so powerfully about that need for role models and potential to go down two roads depending on what is there. I have two tables here in the middle. It is table 10 and table 14. And again, I'll take your two questions together so we can make the best use of our time.
Hello, just following up on the question from table 6 before, directed mostly at Philip. Your point is well made that money flow, it fuels the problem. But the question is there a model where you can kind of flip that and you can take like a controlled number of what we call recreational drugs and control the source and control the quality and control the price and control the distribution channels and use that revenue to feed back into the services, and that then anything outside of that scope is dealt with by the Garda and the legislation in a much harsher way. Is that a model that you think could work?
I'm going to just hold the response until we just take where did I see the other table there? Was there a second question? Yes, just behind you there. Yes, this gentleman here.
Is there any reason why we can't reintroduce Community Garda in estates that require them to at least help?
So the first question, Philip, is as I've heard, it is essentially a question about regulating the market for personal use. Those who advocate for the legalisation, as distinct from the decriminalisation of cannabis, will say, well, look, why did you regulate that market, take the big players out of it, use the revenue, sort of a tax revenue, to go back into communities, and for some that's a compelling argument.
Sounds simple, yeah. But if you look, alcohol is regulated, cigarettes are regulated, and how good are we at keeping them away from those who are under 18? In America, I just read recently the Oregon Safety and Health University. They ran a study and published a study, and it said that the abuse of cannabis, marijuana as they call it, has gone up by 245% since legalisation. And along with that, the growth in the illegal supply of the drug has grown exponentially as well. So it would be great if there was a simple model. I don't know if one exists, and I suppose that's what the Assembly here is to discuss. You know, one other aspect of that study in Oregon was that it also then kind of pandered to the notion that marijuana or hash was safe, and that's what's driving all the mental health issues and the other safety issues in the state at the moment. Now again, they're all studies that are just recently coming out and emerging from legalisation. So I'm not for or against legalisation, I'm not making an argument, but they're just the studies that are there. I don't think there's a model where you can just take some part of it and then put it back in. It might work, you know, for a short time, but it'll be circumvented in some way, I'm sure. But
that question, Jennifer, just about community Garda diversion programmes, JLOs, the juvenile liaison officers, or community Gardaí who know that community intimately and who can serve as perhaps that between the welfare and criminal justice traps that many people fall into. Is it something there should be more of, or is it an instead of? What is the role there for that very, very visible presence?
No, I do think there's a role for community policing, especially in building and fostering relationships in communities like my own. I think it can be very personality based. I've worked with some amazing community guards, and I've worked with other community guards who have very strong opinions about people who use drugs. And I suppose when you talk about the Garda diversion programmes and the juvenile liaison officers, the difficulty with the JLO system at the moment is there's a backlog, and people are often waiting months and months before a JLO is actually assigned. So therefore, by the time they even go through the process, if the JLO at the end decides to bring it to court, it could be 18 months since the young person has actually committed that crime, and now all of a sudden they're in the criminal justice system. And then even when they maybe have multiple charges, there's a shortage of case managers within the guards for the children's court as well, so they're waiting months and months again. So it's constant court appearances, it's constant engagement
and
at
even
that level.
if they're placed into a juvenile detention facility, they're coming out to the next set of charges. Absolutely. Because it hasn't, they're just getting caught up in that perennial cycle. John Paul, what do you think, just in terms of, do you think any form of limited legalisation would help? Do you think there's a way for kind of the tax revenue for that to go back in and help community, or is that maybe just more hopeful? And
well, I'm personally in support of the decriminalisation, to be honest, of an individual in terms of that. How we use the revenue, absolutely, I think it can be reimbursed into setting up projects or resourcing. For instance, good quality youth services or just initiatives. But I think absolutely, for me, personally, myself, yes, I would agree with it.
Yeah, kind of a road tax for drug use. Yeah. I want to get just a couple more questions just in the last sort of 10 minutes that we have. So I know there were one or two hands up. Were there towards the back? Yes, so I think table 13 here and table 2. So again, I'll just take the two questions and then we can put them to our panel. So we'll just go for you there.
Yeah, thank you. This is just kind of a follow-on from table 6 and 10. If drugs were decriminalised, do you think that it would reduce the amount of money going to organised criminal gangs in a broad level of things?
Okay, so the one on decriminalisation on table 2 as well, question here, and with table 1.
I just had a question for Philip there about, he was talking about communities losing control and drug dealers running the areas and intimidation and all. I was wondering, how does he feel we'd get that back through, you know, in time, or how long would it take to get a community back?
Take back control, Philip. It's one of those phrases that has got badly hackneyed in recent years. But where a community is being coerced and is being coerced internally, how do you crack that?
Well, communities are fighting back all the time. You know what I mean? And communities are very vibrant, and they do work together. Say for Blanchetown, along with a number of other agencies citywide, and that we've worked for 2 years on the crime community impact assessment. And basically what that is a problem-solving approach in an area where you bring all of the services, including the community, and everybody who has some small little impact on the situation, okay, whatever the issue is. And whether that's Dublin Bus, whether that's the guards, the local authority, or whoever, you know what I mean, bring them around and how can we solve this problem and what can we do? You look at it, you analyse it, and you come back and you see what you've done, and if that doesn't work, well then you go back again. And it's called a problem-solving approach. It's a proven way to improve your area, you know. So, and that has been written into the National Drug Strategy now, so that has been accepted.
The role of the criminal law and the criminal justice system, Jennifer, is complicated because you know, there could be wide support, including widespread support for decriminalisation for personal use. And then we're hearing this afternoon that there are kids who from a very young age are not just being groomed but are becoming part of the criminal intimidation that is on people. So, you know, often you might hear it say, well, let's keep the criminal law for the organised crime gangs. Where do we draw that line?
Well, I suppose, you know, and Amy's touched on this quite a bit, it's that whole role of the education system, it's the role of child protection and welfare services. It has to happen at an earlier age, and I suppose we have to, the huge investment has to go into that whole family approach. There's no point in working with a 13-year-old in one family if the whole family is involved in criminality or the parents maybe are both using drugs. So there's systemic issues going on in that family, so there has to be a whole family approach. And often what you find is when you're looking for services, the waiting lists for services, or you have to be in crisis stage before you can actually get services. And what you need to be doing is looking at the prevention end of things. So before it even gets to that stage where young people are in the criminal justice system or when they're at crisis point, that investment needs to happen much earlier on.
And Amy, like, I mean, again, it's is it a question of degree and kind? Like, I mean, at what point do you say, well, we will not have any criminal justice intervention here, but once it gets, is it is it a threshold, or what would actually inform that? Because it's so nuanced.
Yeah, it is. It's nuanced, and I think it's about prioritising. We see all the time young people that we work with who are arrested, who are in court systems, who are taking up, you know, who have, you know, minor personal use convictions that take years and years of their lives to be dealt with. And, you know, when you look at all of the different services that are involved in that, the court services, the Gardaí, the youth workers, the money that is spent on that, when actually that investment to be put into dealing with the people who are involved at a higher level, or investing into the communities to stop some of those problems. So I think
it all seems to just come back to the underlying causes, the driving factors that are leading to it. We've just a couple of moments left, and I want to get the most out of the panel. So there's a question at table 14 and one at table 1. So I will take your two questions together. So I think the microphone has landed here at table 14, and then I'll go to you at table 1.
Hello. Very limited experience I'm asking a question from. But I've talked to youngsters in deprived areas, and one of the main draws that they have towards being drug dealers is the money and the status in the community. Would legalisation limit that, not eliminate it totally, but would it limit it to a certain degree?
Okay, that is great. Table 14 and Table 1 as well. Thank you. In your own time. Thank you.
I'm just aware, as we're talking, that there's been an awful lot of studies, reports, recommendations made over the last 5, 10, 15, even 20 years about how we tackle this in all the areas that we've been discussing this weekend and last weekend. So is there anything in terms of what you're talking about here that you think recommendations that have been made previously, or research that's been done previously, or a report that's been done previously that you think we should look at, is my first question. One or two reports or series of recommendations that you think are very good, that we should have sight of. And the second thing is, what can we do here when we get to the stage of writing our own report and formulating our own recommendations to make sure those recommendations are actually implemented? Because I think that's key to how we tackle this. It's not the formulation of the recommendations, because we're awash with recommendations and how we tackle this issue. It's the implementation that stalled things. So I'd love to hear from the panel your advice on how all of us, all 99 of us, can help actually get this over the line and get us to implementation, because that's what we need if we're going to have any chance of making things change. And we need everyone here with expertise in the area to help us get that to the next stage, please.
Thank you. Thank you so much. I'll go, Amy and Jennifer, just very, very quickly on the young people who are looking around and they see status and they see money and perhaps not exclusive, but they're in a disadvantaged community. It is about poverty, it is about money, it is about access to that. So Jennifer, how do you break that cycle?
Look, there are models. If you look at the Uruguay model, they have decided to legalise cannabis, and how they've regulated the market is that once you're over 18, you are given a card, you can access up to 5 grams of cannabis a day. They sell it for $1 a gram, and it's regulated by the government. And the reason they sell it for such a low price is because it removes the criminal element, it removes an element of black market. And I know you were talking about America, Philip, but they still are selling it at market value. So when you remove the criminal element, then that pull is not there anymore.
So sell the drugs yourself, sell them cheaper. Amy?
Yeah, I think just the piece around the implementation really struck me, because I constantly there's reports and recommendations made and there's not implementation or follow through, and I think that comes down to political will. And when we have a cycle of 4-year elections and there's not long-term thinking, and I think we've been very poor as a country to look at actually some of these systemic issues in a long-term coordinated way.
And Philip, Amy has a point there. Like, we could probably paper this room many times over with probably previous reports and recommendations and consultations down through the years. I suppose what's different this time is we've directly involved citizens and people with lived experience in it. To that point of the power within the Assembly, within its own consultations, with its own deliberations, and how it can shape what should happen next. What do you recommend?
Well, it's a very daunting task. As I said, they have, and you're correct, there has been so many reports, it's very hard to remember one over another, and you can probably only remember the last 2 you read while you prepare for something else. But I think for the Assembly and the recommendations, I think for them to be implemented, I think whatever recommendations they make, or the Assembly makes, has to be properly resourced. And there has to be a political will to push them through. I mean, I suppose people at the Assembly now are getting a sense it is a complicated issue, but there are families involved and people involved. And if we start with very, very young children, a wraparound service, if that becomes one of your recommendations and it's properly resourced, you will see results from that, And that's kind of the evidence of all the people working in the drugs issue and at the forefront in the family support. And family support is I suppose, is one of the most important aspects of this, because That's where the hidden harm gets addressed. That's where, you know, workers go in and support parents who, you know, might have drug issues, but they might be based on trauma and things like that. And things can be delved into. But again, if you go into a parent and they're using drugs and it's because of some trauma in their life earlier on, they need to go to counselling. They've got onto waiting lists, and it goes on and on and on, and it just gets very, very difficult. So the difficulty in kind of implementing the recommendations of previous reports all comes down to resources, I suppose.
Mm-hmm.
You know?
And John Paul, I mean, that's true. Like, I mean, it's what you do next that matters. All the reports and recommendations in the world are no use if they're not acted upon.
Absolutely, and evidence has proven that over the years in terms of research and reports that have been out there, particularly in relation to the travel sector, but also in terms of the drug sector. Like, without the resources, and again, unfortunately, we have to say political will at the highest level, a genuine will to deliver on it. You could, as you said yourself, you can write report after report. Unfortunately, it just won't be implemented.
Yeah. And obviously there are a lot of demands on public resources at present. How do you ensure, Jennifer, it gets beyond the 4-year political cycle? This is big work.
Yeah.
This is multi. It took generations to create it. It's going to take some time to.
I think the structures for implementation are really, really important. And I think the fact that people are understanding the complexity of this, you know, it's a cross-government departmental structure that needs to happen. It needs to be people with decision-making power who can actually make this happen on the ground within each of the departments, because it's not just an issue for the Department of Health or the Department of Justice. It goes across all of the government departments, and there has to be accountability. So when things aren't happening or aren't being implemented or aren't being resourced, there has to be accountability.
And finally, Philip, just before we finish up, we're talking about political will, we're talking about education and awareness, but given the prevalence of drug use that you outlined right across our society, what about the public's responsibility? What about society's responsibility in challenging this issue, because we're all a part of it?
100%. Everybody in this room, everybody in the country is affected by the drugs issue. What we term the apathy of the unaffected. You know, people who think, well, I'm not affected, so it doesn't bother me, I don't have a say in it, I don't want to know anything about it. Well, they have to know, like, if their car is broken into, or if their, you know, if their house is burgled, if their handbag is snatched, or whatever it might be. The guards will tell you that nearly 90% plus of all crime is drug-related. So the prevalence of drug use it affects everybody. So you need to start challenging people around their drug use and say that it's not harmless. It's not passive. It's affecting everybody. And you need to think before you buy. You need to think what you're doing is having an effect on somebody else. And I mean, and that's from Colombia, where they produce the cocaine and bring it all across right to the pub or to the house party or whatever you're doing your line of cocaine. It's just damaging everybody. Drugs have not given our society one iota of value. Or any goodness at all. It has just been a nightmare from start to finish. And so people need to recognise that when they start using drugs, and when it comes to the recreational users in particular.
I want to thank all of our panellists today, not just from this panel, but from the individuals, the families and the communities. It's been an extraordinary week for me chatting to them all, and I hope that, like me, you have both been challenged by all of the conversations, but also inspired. I have nothing but the utmost respect for everyone I've engaged with. So it's been an honour once again to be with you, and I wish you all the best in your deliberations as I hand you back to the chairman to bring proceedings to a close.
Thank you, Derval, and once again thanks to our panel, and something that may not come through in some discussion, but I do know for a fact many of the people, like the people we have on our panel, who speak out for their communities, put themselves in harm's way themselves, and I know that for facts, and just it may not have come true, but just to thank you for what you do beyond your voices here today. So it's been a long and challenging day for you all. What we just want to do for the next 10 minutes before we close out is just take time at your table with your facilitators, a kind of debrief. Facilitators will take you through it. When we come back, I will make some closing comments, and then we'll be offline, and Cathal will just make some updates on logistical arrangements for later on. So over to your facilitators for the next 10 minutes. So thank you.